Hi, my name is Taylor Harrison, and today I'll be doing an online module for pharmacology of commonly used drugs to induce labor. This module is intended to be part of a BSN Women's Health class with the focus on pharmacology of commonly used medications to induce labor. This is designed to be incorporated into an online learning environment that will allow students to combine their knowledge from the clinical and classroom setting. This module will cover multiple learning styles. For example, visual learners will have a drug chart. Verbal learners will use the readings and the YouTube videos. After completing this module on pharmacology of inducing of labor drugs, the student will be able to understand the different mechanisms of actions of the three most commonly used drugs, Pitocin, Cytotec, and Cervidil. The student objectives include that the student will be able to compare and contrast the mechanisms as actions for each drug, that the student will be able to demonstrate knowledge on expected outcomes for each drug, and that the student will be able to educate patients effectively on each of the labor-inducing drugs discussed. The timeline for this module will include students completing the required readings, the required YouTube videos, 2 assignments, first being the drug chart, second being the education plan for the patient. More information on these assignments and readings are located on the course website as noted as in your syllabus. The first required reading is the article outcome of the evidence-based Pitocin administration checklist. This goes over a checklist that a hospital developed that before a patient can be started with a Pitocin induction, they would need to meet these specific criteria. This was to decrease the amount of patients that were receiving Pitocin that actually did not meet the criteria, which therefore would eliminate or decrease the amount of adverse effects of Pitocin administration. The second one is Cytotec for induction of labor. It goes over some additional information and details and pharmacology of Cytotec induction. And again, these articles, links to these articles can be found in your course website. The first YouTube video is called Cytotec Induction for Labor, Tragic History by Ada Mae Gaskins. If you've never heard of Ada Mae, she is a pioneer in women's health, particularly in nurse midwifery. She has done a lot of research, produced many scholarly articles and books. She goes over her slight personal opinion mixed with some evidence-based practice that she has come across through the years of the controversy of the Cytotec induction. It has a slightly more increased risk for uterine rupture, which we'll go over shortly. So this is kind of a different approach of a learning style that I think would be important to just consider. The second YouTube video is just inducing labor, side effects, and risk. So why would we ever use these drugs? Of course, we would use these drugs to start the labor progress, so which means effective uterine contractions every 2 to 3 minutes that cause cervical dilation and effacement. Labor occurs naturally when the body produces oxytocin that binds to the uterine muscle cells. Again, the uterus is a muscle. Therefore, it stimulates effective uterine contractions. Why would we induce? We'd want to induce when delivery is desired before natural labor occurs. The medical indications include a woman being post-date, which is considered 41 weeks and 0 days or beyond. Certain complications such as intrauterine growth restriction, small for gestational age, large for gestational age, hypertension, or gestational diabetes. All these medications do have some shared risk factors. They can cause uterine hyperstimulation, which is too frequent and or too strong of contractions. That increases your risk for uterine rupture, which can be deadly for the mom or for the baby. Therefore, continuous contraction monitoring is required when these drugs are being administered. Also, you can have some decreased fetal oxygenation. This occurs normally to some degree with uterine contractions, but when you're having, especially when you're having hyperstimulation of contractions, the babies may not tolerate these contractions as well. Therefore, that's why we're required to have continuous fetal heart tracings during administration of these drugs. And none of these labor-inducing drugs are used to induce labor after a previous cesarean delivery. That is just because there's even higher increased risk for uterine rupture. They do differ by route of administration, by cost, and effectiveness. Now, it is important to note that it's difficult to determine how effective each of these drugs are as far as timing, as when you give the drug and when labor may occur, just because each person at each labor is very different. It is, of course, known that multifarious women will generally have a quicker labor, whether it's induced or not, compared to a nulliparous woman. We'll start with Pitocin. It is the most commonly used medication for labor induction. It is a synthetic oxytocin, so basically it mimics the natural oxytocin the body produces. This medication attaches to the oxytocin receptors on the uterus, on the muscle wall of the uterus, which will stimulate uterine contractions. It is very effective in inducing labor and generally works relatively quick. It is administered through a titrated IV drip and is a high alert medication, so it should be used with caution just of how easily it could potentially be to give an overdose of this medication or to cause some of the adverse side effects. It is very cost effective and readily available and can easily be discontinued if you do start to notice some adverse effects. Since it's IV, the IV can just simply be discontinued. Generally, it started at a 2 milli-unit drips, and then it increases by 2 milli-units every 30 minutes. Generally speaking, the max is 20 milli-units. However, in some circumstances, you can go beyond 20 milli-units. We will not discuss that today. The next medication is Cytotec. This is the one that I said was a little bit controversial that Ida Mae Gaskins goes over. It is a synthetic prostaglandin E1 analog, which means it activates the muscle fibers on the uterus to become more pliable and therefore more susceptible to uterine contractions. The uterus is not going to contract as easily if it's kind of stiff, so to speak. So this medication is often referred as a ripening agent because it will soften that cervix, allowing it to be more susceptible to those uterine contractions. It is a small pill form, usually comes in about 100 microgram tablets, usually is administered only in 25 to 50 microgram doses, so the pill is cut in half or even sometimes in fourths. It's very commonly used for labor because it is actually pretty effective in producing contractions and kickstarting labor. It is very cost effective, only costs about 25 cents for a full tablet. It is inserted vaginally to the posterior fornix every 4 to 6 hours, and it kind of dissolves. Therefore, it cannot be easily removed if complications arise. And again, this medication has an increased risk for the uterine rupture. Some hospitals that I've worked in have actually seen where patients have to sign a specific consent just to have this medication administered. The last medication is Cervidil. Acts similar to Cytotec. It is also a prostaglandin, but it is a prostaglandin E2 analog. So it works by remodeling the cervical extracellular matrix, therefore allowing for cervical ripening and stimulation of the uterine contractions. It is a newer medication, not quite as cost effective. It's $200 to $300 per dose. It is administered vaginally as well, but it's a medication like on a string. So it can be easily removed. The medication itself kind of dissolves, but the string can easily be pulled if, and the medication can be removed if complications are arising. Again, this is a prostaglandin, so it's often referred to as a cervical ripening agent as well, because it will often cause cervical effacement, which oftentimes will also progress to cervical contractions as well. So the two assignments for this week, the first is a pharmacology drug chart, where you will have to compare and contrast the 3 drugs discussed today. And that is a pass-fail an assignment. The second assignment is for you to develop an educational care plan that will include information for the patient, as far as you pick one of the drugs discussed today and go over the mechanism of action, how the medication is administered, what the mother should expect, what the expected outcomes for this drug are, and 3 questions that you feel like the patient may have, questions and answers. This assignment is due by Saturday at 10 p.m. It is worth 100 points. Again, more information in the rubric is listed on your course website. This week's assignments and readings do reflect back to our original objectives. The educational plan and question and answer section prepares learners to demonstrate knowledge, expected outcomes for each drug, and prompts learners to be prepared to educate patients on these particular drugs. The YouTube videos and readings increase learners' knowledge of each drug, and the drug chart compares and contrasts the mechanisms of actions for each drug. I hope that with more information and review of these 3 drugs, you have a better understanding of how and when these medications are used. Thank you for listening.